Okay, we're live. And so this is Senate Health and Welfare on January 9th, and we are back live. We have our witnesses with us this morning. We're taking some time to hear about the good work that's going on with Act 76, the child care bill that we passed last spring. And we are really thrilled to have both of you here, and we'll let you introduce yourselves for the record. And before you start, I'll just let folks know who are interested. We put the timeline up. You tell us how that came about. And so thanks for being here. I think we know you, and you know each of us. So why don't you introduce yourself for the record and listen to your testimony.
Sure. So for the record, I'm Janet McLaughlin, and I am the Deputy Commissioner overseeing the Child Development Division within the Department for Children and Families. And I am delighted to talk with you about how implementation of Act 76 is going and answer your questions. I do have a PowerPoint that I could share if that's helpful. It's in your materials. It's a presentation that actually put together as part of our sort of outreach and education to the field. And so this is based really on what were the key questions we were hearing from people within the early childhood education and after school spaces that work in those fields. I could turn my video on.
Okay, we have, let's see, we'll go back.
Turn off, because I feel like if people are watching, they can only see the back of my head.
Are we on the Act 76 update?
Yes. And then let me show
We've got you from both sides.
You do, yeah. So now you can see the front and back of my head. It's very funny for everybody. But I just felt like for people who, it's quite close. But okay.
Do you guys want me to change the mode on this so that we have the different view?
We're good.
We're good?
Yeah, okay. Now I gotta move this thing and get my.
I love these pictures.
Let's see what I can do here. Trying to get my Zoom thing. Okay. Slideshow from beginning. Okay. Okay, sorry. Let me just move the Zoom bar around. So for this update, I'm not going in the exact order of the bill because you guys know it gets all moved around based on legislative language. But essentially the way that we've organized our communication to the field, including the summary and status chart that you mentioned, is by these 5 categories. Today I'll be giving updates mostly related to Child Care Financial Assistance Program and a couple of the other major items that people have had questions about, but I'm happy to answer any questions on any part of the bill. So first off, starting off with the one-time Act 76 readiness payment program, we were able to stand that program up quickly, partially because we took what we had learned from some previous programs and created a good, and both the legislation included a good design, and we were able to also stand it up on our side. We surveyed the field as we were developing the formula that was used for this, and did a simple, quick application that opened up, I think, in late August, and we're able to make the first payments by the end of September. Of the $20 million, 17.3 million of it is committed so far. The application is open through February 9th, and we are in the process of doing outreach to any programs that haven't applied so far. We think there might be another 100 or so that are still eligible. If they apply now, they would still receive the full amount of their payment. We think there might have been a few programs that were sort of strategically waiting until January and they just want to get it in one lump sum. But we're doing outreach to all programs that haven't applied yet that may be eligible. To be eligible, you do have to be willing to accept child care financial assistance. You do have to be open and serving children right now, and you need to be willing to stay open through June of 2025 at the minimum. So there are some programs that are currently operating that aren't eligible. But we think we're hitting almost everybody, which is good because we committed almost all the money. But it's going out the door. And then we know that another thing to do this spring is to design the quality and capacity incentive payment programs.
Can you talk a little bit about how the readiness payment is utilized by the programs?
Programs have flexibility to use those funds as they see fit, but we've heard from programs how they plan to use it. I have some notes here, I'll see if I can just remember it. So there's definitely compensation increases, whether or not that's sort of one-time staff bonuses, or just increasing hourly wages for programs. We've heard of programs that are starting like retirement accounts and seeding retirement accounts for their employees. We've heard of programs that are meeting some like deferred maintenance or buying some key equipment needs that they needed, that they need to run their program. For example, a program that was, purchased a generator because they keep being impacted by the winter storms and they have to close when they don't have water and all that. So programs are able to use the funds in a way that they feel like really helps them get set up. And we have heard from programs that are hiring up and filling more, because there's programs right now that have had classrooms closed because they, and so they were able to, with sort of this money, they feel like they're able to sort of offer some of their retention bonuses or get the salaries to a level where they can bring more staff on.
Are those 750 providers listed somewhere?
We don't have a public list right now, but we can certainly share that with you, and we can.
Yeah, that would be great.
Okay. Okay, I think I've got a listener in the cyberspace, who will keep my notes for me. My to-do list of the things that are progress.
You're okay with questions?
Of course,
Yeah.
absolutely. Yep. So, okay. Yeah, and so more to come, but that we're in the feeling like that. And I will also offer too, we do have a plan at the end of this to get reports back from programs on how they chose to use the funds, including, for programs that were said that they were hoping to increase the number of children that they're serving, like to find out, like, were you able to do that? And we'll have some of that information later in the spring.
You may have said this and I missed it, but how many folks have so far filled out the application? Do you know?
Oh, almost every,
almost all 750.
So we think that there's probably about 900 programs that may be eligible. And then, so 750, maybe there's 2 people who applied that then once we got into it, we're like, oh, you're not eligible because you're only open during the summer. And by the time we get to summer, the Child Care Financial Assistance rates will be in, all that's in place. So they happen not to be eligible. For the most part, almost everybody who applied is eligible. And like I said, we've got about 150 potentially eligible programs that we're doing direct outreach to right now.
Okay.
So did you actually get new participants in the program?
So in terms of, let's see, well, one of the requirements for the program was that you needed to be be willing to accept Child Care Financial Assistance. And so the way that we knew that you were eligible to receive that you're willing to do it is that you actually filled out a Child Care Financial Assistance provider agreement with us. And so we do, I don't know that exact number, but we do have programs that weren't currently serving children who are eligible to Child Care Financial Assistance who have now signed up and are ready when they have children who are eligible. And, depending on the size of the program and, the mix of families that they serve, there are some programs that maybe don't have families that are currently eligible, but as eligibility increases, we would expect that almost every program would have some families who are eligible. So,
because I understand the incentive was to get more
so we tried to
facilities.
To build that right. And so this is separately, we have efforts to expand existing programs and to start up new programs. So one of the incentives here was if you're an existing program and you wanted to expand, you could get your readiness payment would be increased. So that was there as an incentive.
Mm-hmm.
Separately, we do capacity building grants, and that's through a grant through First Children's Finance as a nonprofit with an office here in Vermont. And they have, right now we're funding that with American Rescue Plan funds because we're still working through those funds. And right now, they just made another round of awards, and I think they had 46 applications or 46 awards that they're making. And I think 20 of them were for new programs, and 20, so then the remainder of them were for expansion of existing programs. So for childcare financial assistance, we are pleased to report that we hit our deadlines. In July, we were able to increase, to streamline the childcare financial assistance program model to separate a program STARS rating or quality rating from how much we reimburse them. And that was something everybody agreed upon from an equity perspective, that we want to resource all programs to be able to offer quality early childhood education or after school care. So that was implemented with the child care financial assistance service period that started July 2nd. So that's why we have these dates are not exactly like July 1st, January 1st, because we need to, administratively need to tie it to a service period. So that, and then we also moved to that higher base rate, which was the 5-star rate, if people remember that. But we just call it a streamlined system with a higher base rate. And because the point is that they're not tied to STARS ratings anymore.
Not tied to it.
And then for just last week, the first round of payments, child care financial assistance program payments that were at the higher rates, with the 35% increase, those went out last Thursday to programs. So really, the CDD team and our partners at ADS and our vendors did work really hard to get that done before the holidays, so that they were went into effect on December 17th. That's when all the programs got new certificates saying this is how much the state's going to pay on behalf of this child now, and all the families got new statements of eligibility saying this is how much the state is going to pay on your behalf, it worked. I guess I don't have to cross my fingers anymore. Now it worked.
While you're talking, I'm deja vu about all the work that we did in here, but I'm just thinking about the amount of work that has gone on to do this, to bring it to fruition. Just amazing what you've done.
Yeah.
Just December 17th.
Yeah, it's definitely a lot of work, but it's the culmination of many years of work in terms of getting that IT system rebuilt.
Yes, but still.
It's just really nice to hear that things happened on time after so many years of getting testimony from the administration that, oh, this is late, this is delayed, we can't do this. So I don't know if it's just you, Janet, or if it's it's nice to hear testimony that things are working.
Yeah, it is. I mean, it is, and it's because the new system was built, it's. But there are people working really hard. I mean, you guys know I've been in this job for about 9 months, and sort of as I learned about things that the CDDIS, right, our IT system. My observation has just been, I was like, there are at least 10 people working full time on the CDD IT system between our staff, who are being pulled from other jobs often, right, to do this, ADS and our vendors, like working on all of this. Like it really is a huge amount of work. And, my observation is that people are like smart and purposeful and working with urgency and using what seems to, the language of like the best practices in terms of how you roll out major technology changes.
Well, that's a shift. That's a shift because that was not happening before. So,
I think that the IT piece was huge in all of this, and then seeing the urgency with the passage of the law, having the law in place. I mean, it's just great. It hasn't happened in the past, and now here it is.
Yeah.
Thank you.
Yeah. And so we're looking in terms of the rates. We're looking to July as the next major change in the rates per Act 76. And this is the new rate schedule, just so folks are interested in it, right? It is, that increase of the base rate last July plus the 35% increase. These are you know, significantly higher than they were before. And I do think that is probably reflected in the interest we're seeing in expansion and startup of programs. But again, we'll have to see how the trends play out over time. But the early indicators are promising.
Is this a per week?
This is per week. Yep.
Childcare is expensive.
And down that road.
So, and I just wanted to give an example, and this is a real example from a program that we had talked to. But again, I think the other thing that when we talk to programs is just that everybody has a different rate structure. Everybody has a different, you know, people are serving different hours. They're serving different ages, and so it's really difficult to provide you know, an overarching picture. But this is just one example we thought we'd share, right, of a before and after. And in this case, you can see that where we've landed is that, you know, before the family had, because this, you know, the state was paying less than the program was charged, than the program needed to charge to cover their costs. The family was responsible for an additional copay of an additional $72 a week. And now we can see that, again, that now the state is able to, with the increased rate, the family doesn't have to have that additional copay. They're at that rate that sort of we've defined as affordable. And the program is actually receiving more money to be able to, you know, care for that child and, you know, put to the stability and growth of their program.
So when will you know, is there a report back? Who provides oversight on this to see if it meets the goals?
Yes, that will be, we'll hear from Dr. Crossman with Building Bright Futures. They're really tasked with, you know, partnering with the administration on doing the metrics and the reporting. Okay, for just to remind, for eligibility, remind the expansion of eligibility hasn't happened yet, right? That will happen. The first increase will happen in April. There also will be a change to the weekly family share for, you know, one group of people that are between 150%, 175% of the federal poverty level will not have a weekly family share anymore. And it's really next October that the big eligibility increase goes into place. But what we have done already is allocate the additional $2 million for community child care support agencies to hire up and train eligibility specialists because we know that they will have a lot more families coming into the program and we need to get them in place and trained in advance. So that part's in place. And our CCFAP staff team is busy, you know, offering that training.
Any burdens on your agency as far as, you know, were you able to financially support all your needs to implement the program?
Yeah, so we have hired up for the staff. There was 11 staff positions in the bill. We have now hired, I think, all but one of those positions right now. It definitely was a little tricky, especially, you know, from July to November. Like the new people are just started, right? Because it takes a while to hire and get everybody in. So we have kind of been doing this work without the extra people yet. The extra people have just arrived, so we are training them right now. So we do see a future in which the workload feels a little smoother. But it's definitely, people have been working hard in the last bit here. But we feel like and right now we're in a moment, we still do have American Rescue Plan dollars that we can use to fill some of the gaps. Those funds will expire at the end of September, so we're working hard to spend all of that down. But there's a few, we've got those funds, and then there also is the Federal Preschool Development Grant that also we're starting to spend against as well. So right now we're able to, it's really about sort of getting everything coordinated to be able to use the resources, I would say, at this moment.
Yeah, the federal dollars were really a big part of having this go forward.
Yeah. So, and you guys can tell me if you guys feel like I'm getting too in the weeds here, but this is, in terms of eligibility, I wanted to, this is sort of like an income guideline chart that's presented to families. And we haven't produced the new one of these yet for April 1st or for next October, and that's because it's tied to the federal poverty level, right? And so we don't have the 2024 federal poverty level yet.
So I'm seeing here, it's effective February 2026, so the new one will be coming out somewhere in February.
Somewhere in February, we will get the new federal power, we'll get the 2024 federal poverty level.
There it is.
Our plan is for on the child care financial assistance service period, that's either right before April 1st or right after April 1st, whichever one, like we can get everything organized for. But then that's the point at which we will, we'll be aiming for that service period to roll out the adjustment to the eligibility levels for the federal poverty level, expand this chart to include 425% of FPL and 450% of FPL. And at that point, we can signal to folks what are the income eligibility levels for October 1st, but people can't really apply in advance because you need to have current income information to be able to apply. So, and that the IT system is not set up so that we can have two sets of rules in it. I will say that. So we can't be like, oh, here's the pre-applications and process those. We really have to wait, but we can, like if somebody's application wasn't processed until mid-April or something like that, we could backdate it back to April 1st or the start of that service period. So that's what's coming. And that's sort of why we also haven't done a lot of communication out to families yet, because the eligibility for families, their eligibility hasn't adjusted yet. And most of the changes so far have been programmatic. So we do have plans to do, create a more robust communications campaign and do outreach to families, but it's not the time to do it quite yet. The next major item that we are definitely getting a lot of questions about whenever we do an X76 webinar is around pre-kindergarten education and what changes are going into effect and when. And so we're doing a lot of education with folks around the fact that where we're at right now is we have a committee, and I'm one of the co-chairs along with Interim Secretary of Education Boucher. We did meet the deadline to establish the committee on July 14th. You guys may remember that was a few days after the flood. And so it was, It was a quick meeting. Yes, it was a very quick meeting, I will say that day, but we did meet our timeline. And then we have just gotten to the place where we have hired a facilitator and project manager, and we'll move through. We've been doing more sort of education with the committee so far. I'm like, what is our charge? What's the current status? And then now we have the facilitator and project manager so that we can really move forward on our charge there. And we've been really directing folks who have questions to that committee, saying this is the place where you should, these are public meetings, you can make public comments. This is the place, that's the place where talking about pre-kindergarten education. So
are the meetings recorded and put online as well as being public?
So the meetings, all the minutes, all the agendas and the minutes are published. My understanding is Agency of Education doesn't post the recording, but if anybody requests it from us, we can send them the recording.
Okay.
That's my understanding.
Do you send, maybe if you're interested, you probably could have the day the meetings are taking place.
Yeah, I think
Attend remotely.
I think with three of us being in this committee and education, it would be nice for us to have those recordings. So I can request.
Okay.
Thanks.
And you submitted the report on the pupil waiting.
Yes.
But my understanding was that the recommendation was to not move forward, even though everyone agreed wholeheartedly that the wait should be changed to at least one.
So everybody agreed that in the context of a full-time pre-kindergarten slot, that it is that it certainly is not less expensive to educate a pre-kindergartner than it is to educate a kindergartner. So I think everybody agrees on that. And then the question is, should it be higher than that? Is it actually more expensive, which is what most states have found? And then I think the unanswered questions were around prorating and things like that, of so if you've got, the UPK law currently is organized around 10 hours, and then there's
Mhm.
some people that are offering a full school day context, but what about the people that are offering 15 hours a week or 25 hours a week? And so I think, I think that, I mean, so that's what the report was offering, was like, there still were some unanswered questions. And offered a suggestion of actually updating the pupil weighting formula with the real question, with pre-K information rather than.
Updating, what my understanding is what the recommendation was, to update the full pupil weighting study, which would be a couple years process. So I'm curious why you don't just recommend, I mean, it was a no-brainer to me and to many other people that pre-K should be at least a 1, and we should implement it. And there's a way to do an FTE, you know, if the student is only there for half time, to do 0.5 of a student.
Right.
And so it's curious to me that the committee didn't more strongly recommend it, because I think it's really important for adding capacity to pre-K to have that weight in place. And I'm incredibly frustrated that it's taken so long to get to this place, because as someone who has dug very deep into school finance, it's obvious that, and it probably is more, but to leave it at 0.46 instead of moving it to 1, when everyone agrees that it's at least 1.
Let me ask this question.
Frustrated that the recommendations didn't come out more strongly, because I think it's really putting it in a place where expanding pre-K is really problematic right now. It won't happen until we do that, and asking for another study is going to delay it and delay it and delay it, and it's really a disservice to pre-K.
Who is on the pre-K committee, in addition to you and interim secretary Boucher?
So there is the list is on the web page, which I'm happy to share, but it does include Josh Crossman,
Right.
and it does include folks from, it does include a few pre-K partners, a family child care program and a center-based program. In terms of school-based folks, it's the, Superintendent Association, Principal Association, right? All of that whole crew. Special educators are represented. So that's.
So I think Senator Hardy's question is a legitimate one.
Yeah.
And it may be a question that the folks who are on education can ask, because I agree that we would like to see some progress on this, but it does have cost implications, of course. So anyway, just to say, I think there's some legitimacy to that, and it would be great for ed folks to take that down the hallway and keep us informed. And there are some other areas of the weighting piece that I've been very concerned about and talked with the chair of education about. So, but we don't want to get fully blown off. But that one, I know, was a long conversation in here and in education and with our House counterparts.
And before we move on, I just want to echo what my colleagues have said. I completely agree with everything that was just stated, for the record.
Yeah, I think it needs to happen, and it needs to happen faster than redoing the pupil weighting study. That's a ridiculous bar to have to set.
Senator Williamson.
Just a very, very informative. Thank you for the presentation. Question I got to go back to my providing oversight. You said Building Bright Futures.
Yes.
Is that I'm familiar with Building Bright Futures, but is that a private entity that's monitoring a government program?
No, and we're going to hear from Dr. Crossman, and she can answer your question and explicate a little bit more.
Yes.
Thank you.
Yeah.
We don't want to interrupt your.
No, it's
too much, but you
it's fine. I mean, I think
you've heard the message from.
Yes.
I think.
My question is, who's accountable for, obviously
we
you
are.
are.
Yeah. No, I think, yes, we feel accountable for delivering against this, but we're glad to have, a partner in Building Bright Futures in determining the right determining the metrics that are most of interest to everybody, figuring and making sure that data is shared publicly. And again, Morgan will talk more about that. I wanted to flag a couple of things in the bill that have come up with more questions for us. And so this is one of the areas that we've heard from a number of childcare program directors and owners about. One of the things that was in the law, right, was a tuition rate increase cap, which said it's now, it was capping the amount that a program could increase its tuition to 1.5 times, the specific index of educational costs. And so for this year, that's a 7.2% increase. There were plenty of programs for whom they're like, yep, I was not planning to increase my tuition for private pay families more than that, like no problem whatsoever. And then there's other programs who maybe have been using they were using their ARPA stabilization funds to subsidize their tuition. So they hadn't increased their tuition for a number of years, or, they're, like redoing the rate structure, and they have they have a plan associated with worker compensation or something like that, that they feel like this limit is tricky for them to manage against. And the other thing that's tricky is, so there's some people, there's great people are planning right now for next school year, and I can't tell them what the cap will be until later in 2024. So this is just a place where we're running, but there's been a lot of questions. A lot of it is just, we can clarify, this is what we mean, this is what this means, and there's just been a lot of clarifications. But there's been the question too, there definitely been programs that are
So, yeah, some of
struggling
the
with this one.
concerns I've heard is that the cap that was placed was arbitrary, and therefore we should be, now that we have more information, we should be making a change. And so there is a bill that we have in our committee, 188, that speaks to possible changes. But you're suggesting that it's premature to do that?
No, I'm just flagging for you that this is one where we're
It's
getting
just an
lots of
issue.
questions,
Okay.
that we're getting lots of questions, and that we're getting, and that there definitely are some programs who are concerned about this. We do
Okay.
know that even at those increased childcare financial assistance program rates, that is not, is still below what the RAND study had estimated for the cost of high quality care. And so there's folks who are concerned about that. So I'm flagging it for you guys because it's been flagged for us. That's
Okay,
what I'm
good.
doing.
We got it.
And then this is another one where we're getting questions, but I think it's okay, but we're just getting lots of questions on it, is around the fact that programs can no longer accept application and waitlist fees for children who are eligible for childcare financial assistance. And we are getting lots of questions about what does that mean? Does that include enrollment fees? What about art fees? Or and the way that we interpreted this based on conversations with members of the legislature, right, is that this is really about those fees charged before a child is enrolled. It is offered a spot in a program. And so, so it's just like you have to pay $30 just to even be considered for a spot, or you have to pay $75 for them to even review your application. And that is what this was designed to address. And so, there are folks who are like, oh, that sounds complicated. I'm like, you will have to add one extra step to you can either just get rid of application and waitlist fees, that's one option you have, or you're gonna have to add an extra step into your process where you're reviewing that, and you have to think about how you're handling that from an accounting perspective. But again, this organization, First Children's Finance, that I mentioned earlier, it's a nonprofit. CDD funds them to provide business technical assistance to childcare programs, and they can provide advice on how you would structure something like this, as well as how you think about your rate structures overall.
Can I just ask about I know you mentioned this before, but are they located in Vermont?
So they're a national nonprofit, but they have established a Vermont office. And so they have, I think, five or six staff people who are based in Vermont who have worked within early childhood education after school settings in Vermont.
Okay. So it might be interesting to hear from them.
Yeah. Erin Roche is the executive director.
Okay.
Who is it?
Her name's Erin Roche.
Okay.
I was mentioning it because she lives in Addison County.
Yeah, I think I know her. Yeah. Okay. Okay.
And then The other thing I just wanted to flag for you is we have been trying to be really transparent about where we are and all the different elements of the bill. And so, you know, we did stand up a webpage, and that does include that summary and status chart, which is something that helps keep us on track too internally of what every element of the bill and like what the current status is. We put on any of the memos that we need to put out related to the bill. So like we had to put a memo saying no application fees, because we will. In December, we worked it into the provider agreement for childcare financial assistance, but the law went into effect in July, so we had to put a memo on it. So the related memos, the related links, so to things like the Department of Tax has a childcare contribution webpage now to explain that side of it, or the link to the
That's
pre-K
awesome.
committee. And then we also have FAQs. So trying to get ahead of it, because and just emphasizing for like everybody we talk to that this is a huge bill, many facets to it, and you know, a rollout, you know, extended implementation time frame, and so that it's natural that it will feel confusing, and we're here to help you.
So on the tax notice that's now there, how did that happen? Did you reach out, or did they do that independently?
No, they did that. They did it themselves. I think they were getting lots of questions about the childcare contribution from the sort of the tax community. I don't know if that's a concept, but
Well, when the taxes are coming.
from the
around,
tax
so-
preparer, from the business, right, from employers as well as from tax preparers, like trying to
Yeah,
think about how to, but I think it was, yes, it's the tax lawyers were asking the questions.
that's good.
Yeah. So they have it up there to explain.
So the biggest question, I don't know, there are a lot of questions as you go forward. There's so much work going on. It's really terrific. I'm gonna just, maybe you could, is that your screen up there now? Maybe.
Which,
Your,
sorry, I did just took down my presentation, just so if that,
yeah, you don't need to have your.
Okay. I will stop. If that's
Because
okay,
you're
I'll
here.
stop that.
Yeah.
Yes,
That's good.
Okay.
Yeah, that's great.
sorry.
Just generally, you've worked so closely with so many different providers and programs. What's the kind of culture and emotion or response? How are people feeling?
Yeah, I mean, I will say, I think that there's sort of two camps. There's a lot of skepticism out there, actually. I mean, there are people that are like,
Huh?
really? Like this much more? Like, are you making it, like, what's the catch? And you're like, there's no catch. So there's definitely both, right? And also, I mean, definitely heard from folks sort of on that, like, you know, emphasizing that, you know, these are, you know, that we recognize that smaller programs and family childcare programs are a core part of the, you know, of the ecosystem that we need of care in the state. And so emphasizing those pieces and doing some of that outreach. But mostly I think people are feeling, I think there's a lot of people who are feeling sort of excited and relieved. But there has definitely been some nervousness. Like,
That's why I asked the question. I
Yeah.
asked, and I'm hearing a lot of skepticism.
yeah,
Number one, it's a lot of money, but the reason it was designed was to get more people involved in it, because we need more childcare.
mm-hmm.
So if we get the goals, achieve the goals we set out to achieve with this, it's worth the money we spend.
Mm-hmm. So yes, so no, we
But it's a lot
definitely
of
want to
money.
make it, yeah, it is a lot of money, and we want to make sure that it's, yeah, that it achieves the goals.
So I'm not covered, I'm not sure if this topic will be covered by you or the next presentation, but I understand from the original bill that there was an education piece associated with healthcare or childcare providers and assistants. That education goal, how do you feel about? Are there enough providers in the state to educate the workforce that we're intending to now we'll have to ramp up to a different requirement? And how is the workforce reacting to the requirement to improve or enhance their education?
So Act 76 did not include any changes to educator qualifications specifically. It's really sort of putting the resources there first. And then, and right now we're using a lot of like the American Rescue Plan dollars, right, has been supporting the growth in the education, or is supporting educators who want to increase their credentials. We're seeing it, so that's separate from Act 76, but we are seeing, significant interest in those programs, growth and uptake. Someplace like Community College of Vermont, early childhood education is their largest, concentration or major in terms of certificates and associate's degrees. There's a lot of people who are interested in getting those credentials, and a lot of them have been, they've been taking non-stackable professional development for years, and ultimately not ending up with a degree that maybe can support them when they finally, when they maybe decide that they can't get up and off the ground with toddlers. And so, I think there's lots of people that are feeling like, as long as they are supported in getting those degrees, and that they don't have to pay, and it's financially affordable for them, that they're eager to get them.
I just want to add an anecdotal thing that I heard from one of my childcare providers in one of the largest programs in my community. And they said for the last number of years, they've had one or none of their teachers going for, more education. And this year they have 5. And it wasn't because of the extra money that available necessarily, because the ARPA money has been there for a few years. It was because they felt like there was a future in the field, because there was more money that was available and more attention to early childhood education. So just that sort of optimism made them want to go on to get more credentials in early childhood education. So
if you attain your goals, if Vermont benefits from an increased number of facilities and workers, is there money in the system to absorb any additional facilities that we get? How would you manage the actual growth?
I think that's
That's a good question.
That's a good question, right? I think that's something that right now, because the system has been under-resourced for so long, and we have not been hitting our, we know that we haven't had the capacity that we've needed. I think we do need to monitor really closely, like, what is the growth we're seeing over the next, what's the trajectory we're seeing in the next 3 years, the next 5 years, and then it's going to be the question of, to the resources that have been allocated, keep up with this.
Competition is healthy, but it gets us to a certain point where you may have to start really looking at the standards being met. And
so that might actually be a good thing to have, because that means we'd be getting more kids, and that means we'd have more families in the state. And one of the problems with early child care is, in particular in our colleges and universities, it's never been valued, and it's always been seen as, just taking care of kids. But it's a real study of neurodevelopmental issues, childhood development, behavioral issues, mental health needs. And so now we begin to understand it as a society and support it, and understand the value of having these folks be supported themselves going forward. So I thank you for the work that you're doing. It's great.
Yeah, thank you so much. We're sort of tasked with telling a story about this program, because we do get complaints about the price tag, and I love the data is going to be super important. I also love the anecdote that Senator Hardy just shared. If there's any way for you all to sort of curate some of these anecdotes as we go forward, it would be wonderful.
Yeah.
That really tells the story behind the numbers.
Yeah, and I'll offer one. This is not an anecdote. This is actual data that we looked at, which is and it was looking at September, and we'll look at December soon. But at the end of September, what we were seeing was that the number of children that childcare programs wanted to serve was increased from the September before, and it was getting back to sort of pre-pandemic levels, which is what we're looking for, and obviously we need to keep growing. But the because there's the license capacity, right, which is how much a program is like legally able to care for based on their physical infrastructure. But then there's been programs, right, that haven't been enrolling to their full licensed capacity right now, because they haven't had the staff, or for COVID reasons, they wanted to have a smaller program. And so but we go and with our referral specialists, they find out from each program how many kids do you actually want to serve. And again, that while licensed capacity wasn't increased as of September, the desired capacity, like how many kids you actually want to serve, was, we were seeing that increase. So we're tracking both of those things. Both will be tracking what is actually licensed and then what is actually the desired enrollment. The trick, we don't know exactly who's in all those spots and if they're shared between families, but.
Is now the appropriate time to ask about a specific program in, like one in Burlington, for example, or no?
Well, let's hold
Yeah.
that thought, and then
Okay.
we'll hear from Morgan Crossman.
Okay.
And then maybe we'll have time to come back to that, or it might be something to ask offline, I'm not
Okay.
sure, yeah.
Okay, thank you.
Thank you very much, Janet, Deputy Commissioner McLaughlin.
Okay, we have to move these.
I know,
Yeah.
right?
Give them to Dave.
Give-
They're too
put 'em
No,
on
no, no.
chair, zip line.
Yeah, put them
Put
on.
them away.
Oh, what's the matter? You need chocolate, that's good.
Can you get that to Jen?
I've
Sorry.
already had one. I
Oh,
just
no.
can't keep having more.
Okay. Yeah, you can do that.
All right.
All right.
Good morning.
Good morning. How is everyone?
Thank you for being here. So why don't you introduce yourself to the record, and you've got a great PowerPoint, I think, so we can look and listen, and the timeline is still up here. It's great.
So for the record, I'm Dr. Morgan Crossman. I'm the Executive Director of Building Bright Futures, which serves as Vermont's Early Childhood State Advisory Council. And related to the previous question, we serve as a public-private partnership. So we are charged in state statute as holding the vision and strategic plan for the system and monitoring and accountability for both the system as a whole, the legislature, and the administration. So really holding that public-private partnership space as a neutral entity, a nonpartisan independent entity that is really focused on data-driven decision-making. And I'm excited to be here to talk about Act 76 because specific to this law, we're responsible for partner engagement. We're responsible for collectively defining and measuring success as a state. Providing technical assistance to the administration, primarily to the Department for Children and Families and the Child Development Division and the Agency of Education, but mainly supporting that accountability and helping folks with data-driven decision-making. So today, as a quick reminder, we are 6 months in. That's it.
Early days.
Exactly, right? We are in the initiating phases, the planning phases, and yet there's still been so much implementation that's already happened. So what I'll talk about today is what you will see next week in a full report that is due to all of the committees of jurisdiction. So very high-level overview of our 6-month process to build systems in partnership to monitor this piece of legislation. And several of you have actually been engaged in different pieces of that. So I'm going to walk you through early childhood system engagement in monitoring. So who did we ask and what did we ask them in order to build this vision? What are we looking at in terms of accountability and measuring success? And then where are we right now, 6 months in terms of process? And I really appreciate this committee calling attention to the fact that numbers don't tell you everything, and that qualitative data is just as important in monitoring this law as the numbers are, especially given some of the answers that we don't have in the quantitative data. So in terms of stakeholder engagement or system engagement in monitoring, we've executed a 6-month process to compile feedback from stakeholders across the state. The goal was to say, do we have collective agreement on what success looks like in this law for Act 76? What should we be measuring? And then moving into how do we develop strong mechanisms to capture data we don't have? And really to look at it, as the Deputy Commissioner said, not just in this year, but how are we looking at year 1, year 3, year 5, year 10? How are we setting ourselves up to look at change over time? So what we did is ask 2 key questions. What would success look like across all of your areas of legislative intent? And what are the top 3 things we need to measure in order to know it, to know what the impact was. And as you can imagine, people are invested in different pieces of the legislation. The things that they care about are also showing up in the things they want us to measure. And so there is not one single indicator where I can hand you a number that says, yep, we did it, or no, we didn't. And that's good.
Shucks.
I know. That is the standard response. The good news is we had a really robust engagement strategy. So over the course of the last 6 months, we held 13 different focus groups with public and private partners, folks from the legislature, the state advisory councils. We used existing structures, and then we also reached out to partners that have really strong expertise in key areas. And we had an engagement of over 80 partners in that process. And we also fielded a survey with 79 cross-sector responses. So 2 different strategies for understanding what people care about and how that would translate into what we should measure. When we analyzed all of that feedback, and Senator Hardy remembers when we presented it to the State Advisory Council, there were hundreds of indicators, over 150. That were compiled by different areas of legislative intent. And we have now compiled that and refined it into 9 final themes. So we actually have a 2-pager that you will see in our report next week. And the 2-pager is just a way to simplify the information and say, if you were to look at anything, here are the things people care about the most. And I'll talk a little bit more behind the scenes about that 150 plus indicators that we are still monitoring and tracking. In terms of what to expect as we move forward in terms of partner engagement, there are so many different pieces of the law that it also means there are so many different strategies and mechanisms we need to use to monitor the law. So we are working really closely with the Child Development Division, with the Agency of Education, a range of data stewards across the system, and now a team of national researchers from Child Trends. And I'll talk a little bit more about the grant we just received with them in a few minutes. So just to name on this very process-heavy slide that we are continuing to hold focus groups and discussions with our agencies to say to them, where are you seeing success? What does that look like for you? Where are you stuck? What are you struggling with? Is there anything that's impeding progress in this area, and documenting those pieces? The Deputy Commissioner also showed you their status and summary report chart. That is the primary place for us to go to say, are we meeting the timelines that were set? And where are their challenges? And that's where all of the links are centralized. And you'll hear, I do have a lot of qualitative information to share from the field expressing their deepest gratitude for the amount of centralizing that the Child Development Division has done for that.
I mean, this chart is just indispensable.
It's incredible, and the challenge with the printed version is that they are updating it weekly, right? There's so many things that are happening that are linked. So just naming that, it's incredible. That is phenomenal. This committee has it on the wall, and that you are actively looking at this to say, where are we? And for folks who are able to look at it virtually, there are links, there are resources, there are reports. There's so much that will change.
We have it, yes, we do have it electronically. So as the links change, we'll get the update. This is just to remind us. Yeah, it's great.
Mm-hmm. So one of the newer pieces that we're really excited about is that we will be doing focus group and surveys with families, providers, and folks that are most impacted by this piece of legislation. So one of the areas of growth for Vermont is that qualitative data capture and actually talking about it in a more meaningful way, right? It is telling that story and how do we understand what this law is doing for the people that it is intended to impact. So that will start taking place over the course of this year in collaboration with the Child Development Division and Child Trends. Some of the other pieces are, again, very process heavy, that we're going to continue using our strategic plan committees to host discussions. So most recently, the Child Development Division team came in and utilized that committee in a really strategic way. They said, here's where we are with this piece of the legislation. Give us your feedback. Tell us, how does this impact you? How does this land? Is there anything we should know before we move forward? So it's really a beautiful partnership in seeing our work come together, and to really partner on the implementation of the law. We're also continuing to partner with the pre-K implementation committee, and I'll talk a little bit more about some of those challenges. Some of them were already named this morning. We also have something called an emerging priorities tracker, where we are hearing from all of our regional councils across the state, our strategic plan committees on a monthly basis. What are you hearing that either needs kind of state level action? What are the major challenges or things that you're trying to solve locally? And we are using our state advisory council, specifically our agency leaders, to provide that information to them. Sure.
So is emerging priorities tracker part of this presentation as far as, or is it?
It's not. It's something that we have and are using behind the scenes that gets sent depending on the time of year. So for example, when flooding is happening, there are so many emerging priorities and issues that come in. When there is a presentation from the Child Development Division, or there's an upcoming presentation about something, we'll often hear more in that area and be able to allocate. So it's an internal document, but we are going to be using that in terms of the actual monitoring broadly to say, okay, related to Act 76, here are the 15 things that partners were either struggling with or we're reporting were successes in that area, and then including them in the broader tracking. But it's not a part of today. And we will be making all of the data publicly available at Vermont Kids Data over the course of this next month, based on whether or not the data is available. And as I move to this next section, you'll understand why that's really important. I think the other thing that I want to name for us as a state is that we need to be committed and are to continuous quality improvement. So we are in 6 months into implementing the law. There are things that are working well. There are some roadblocks and challenges. And so each session, reviewing that information and making potentially technical corrections or things like that as we move will be really important. And from an implementation standpoint, that the agency is also in that same space of continuous quality improvement. There are going to need to be shifts over time in how we're doing things based on that data. So where are we in terms of actual metrics and monitoring success? Right now, we're in a phase of designing the baseline measures. So in order to look at something over time, we need to know what we have right now. And we need to do that in a way that creates buy-in and shared accountability across all of the different partners, right? So it's from the people who are working directly with our kids and families, who are actually going to collect and report that data to the state. It's the state agency leaders who are then working and cleaning that data. It's the legislature, it's all of us. And it's our collective responsibility right now to make this law work. And I just want to remind folks of that. We have tasked our agencies with it, and there's so much communication that we all have to have among each other and to the field about how to do this well. So we brainstormed collectively over 150 indicators across all areas of legislative intent. And that sounds like a lot of data. It is. Senator Hardy was there. She saw it.
I saw the list.
She saw the list, the original. And while that list is important, I think one of the most important things I can let you know is that we only have a third of that data right now that can be used to inform decision-making. And again, that list is very discrete measures. It's very basic data on the number of kids here in this setting or disaggregated by geography, race. So we won't be able to look at all of that at once, and that's okay. We also have a ton of plans in place to capture that data and make it publicly available. And so again, the only thing I would want to reiterate in that area is there's no one indicator that I can give you. I can say, if you're interested in access, here are the top 5. And if you're interested in workforce, here are the top 5 that people care about.
But that's good. That's great, because then you have the categories, and yes, awesome.
Exactly.
Yeah.
So that's what I'm going to share with you on the next slide is one example, and you'll see that full 2-pager in the report. And what we're calling it is an Act 76 indicator snapshot. And what you will see in that 2-pager is the 9 themes: equitable access, quality, early childhood workforce, affordability, fiscal implications, program stability, Vermont's overall workforce, child outcomes, and then the experiences of those most impacted. So I'm just going to show you 2 of those themes today so you can see how we've broken it down. So the next slide shows you that related to equitable access, there's a section called collected, and there's a section that you'll see on the next slide that is all the gaps that we have in that area. So if we're saying collected, that means somebody in the state, an agency, a private partner, some data steward has collected data, and namely in the childcare space, it's the Child Development Division. That data is collected, but it's also possible that data is collected but hasn't yet been analyzed or cleaned and made publicly available. So in that report that you see next week, you're not gonna have all of this data. You're just gonna see the plan for the data that's coming in the next few months.
Do you,
Sure.
got a question, do you believe you have a baseline for the 154 or 48 or whatever? I mean, do you know where you were like pre-Act 76, so you can compare, or are you jumping into it as Act 76 on rolls?
Great question. So at Building Bright Futures, we produce a broad snapshot every single year called the State of Vermont's Children, not specific to Act 76, but we do actually have a ton of data on our early childhood
So you have a
system.
baseline.
We have a baseline of collected data specific to Act 76 though. That 150 is just a way for us to show you that if we were to really be able to measure everything that people feel is important, and most of it truly is basic data on where kids are and how they are doing in different sectors, that we have a long way to go and that we're working on towards that vision of actually having that data. But if from a research standpoint, when we're talking about baseline data, we don't necessarily have a baseline, meaning here's all of the data that everybody cares about and the number, so we can look over time to see how much we've built. We have it in some areas, but not others. So that's what I'll talk a little bit about.
Did you find that 154 is maybe too many metrics to look at and you need to kind of shave it down?
That is what we did, right? That's exactly where we landed, and that's why you're seeing the compressed version of it. So when we say 150 metrics, it might be that we're saying a child is enrolled in an early childhood education program, and we can break that down by geographic region, by program type, by quality level, and by demographics. That right there is 4 or 5 indicators. So when I'm saying indicator, I don't want folks to think that it is a massive spreadsheet, but it is actually more simple than that. So we do have a lot of that data.
So you mentioned, I'm going back to my oversight question.
Yeah.
If you could break those 54 items down into functional areas, does the Department of DCF have areas that they're going to be keeping an eye on, or collaborating with Building Brighter Futures for
Yes. Yep. So what you're seeing on your screen right now is one of those areas. It's one of the 9. And this is the data that we have, that largely the Child Development Division, sometimes the Agency of Education, already has, that would tell us about equitable access to services and early childhood education. So what you can see here is that we have quite a bit of data on programs, right? You're able to see that we have the ability to look at all of our regulated programs across sectors. And what we can't do is currently look at trends in enrollment, the availability, the demands, and programs that are not regulated by our agencies in this moment. So when we say enrollment, we can look over time at the number of children who are enrolled in universal pre-kindergarten education, but we may not have that same number or ability to look at regulated childcare and after-school programs. And because we don't have that baseline, we also don't have it broken down by what people care about most, which is tell us what region of the state we need to prioritize resources. Where do we actually need additional slots? What does that look like? Again, we have a ton of proxy data that we are using, but in terms of the hard numbers and the very basics, we don't have that utilization data. We also are not able to talk about availability in a meaningful way right now. So for example, childcare programs have all different schedules, and families have a bit different needs based on the choices that they make for their families. So right now, availability and demand are really hard to understand and definitely broken down by different parts of the state. The good news is, on the demand side, we've been partnering with the Child Development Division. Let's For Our Kids is producing a report on the number of children likely to need care. So we have estimates for that, and that is how we are currently monitoring some of those pieces. So, go ahead.
I was just gonna say, as you were going through this, it strikes me that one of the benefits of the system that we have and the diversity is that it is diverse and it offers options for families. But understanding where places are, where the needs are and where the services are is so critical. It's an analogy of the community engagement process that's going on in Act 167, but anyway.
Yes.
I didn't want to interrupt you, but you went by where my comment was, but.
So again, we have a lot of data, and there's still some major data gaps that we're going to tackle together over the next couple of years to get to a space where we can really effectively monitor and report back to folks about change over time, and that's okay. One of the things that I don't have a slide for that I want to mention is how we're going to be capturing the experiences of those most impacted. So the Child Development Division, Building Bright Futures, and Child Trends, which is a national nonprofit that has a ton of expertise in the early childhood and the child care policy space, were just awarded a 4-year grant to specifically study and examine changes in child care subsidy policy on families, providers, and those most impacted. So
Is that Vermont based? That's the Vermont?
we
analysis?
are, Building Bright Futures is actually going to be leading the data collection. Child Trends is providing additional capacity to design the right research questions with us and with the state and with our partners. And then the plan will be that as we are developing new data collection mechanisms, that we are then integrating it into CDDIS and what the state is doing. Because what we don't want to see happen is partners come in and build capacity for a snapshot in time and then not have that data later on. So we're really excited about the fact that that will build all of our capacity to answer a lot of those data gaps that I mentioned as we're moving from 154 to something more manageable like 50. So again, the good news is we do have partnerships in that area, and that snapshot, that table will be really helpful. What I think is most important, if you took one thing away, is what people care about is equitable access. That was the number one thing that came up from partners across every sector. How do we know that we have equitable access to early childhood education?
So while you're doing this, and the one that catches my eye is the unregulated programs piece.
Yeah.
And are you looking to make recommendations about an integration of that regulation
So
oversight? Because I know part of it's in the executive branch over here, part of it's here. We just tried to merge those together in the budget last year, but so the after school. How are you going to be looking at that?
So I think one of the things to note about the data gaps is that part of the process over the next year is for us to decide what we want to prioritize. What data do we absolutely have to have, and what data do we need to let go of, right? So if you're seeing it as a data gap, we're naming it because multiple people across the state said this is something really important, and it might not be something that we're tackling in the next 3 to 5 years. It may still be a data gap, but we need to prioritize what we're collecting. So when I look at unregulated programs right now, that's a data gap for a reason. There is no possible mechanism in place for us to do that well. And the question is, for all of these, where do we prioritize our efforts based on who needs that information to be able to either make policy change, or, one of the things I talked to the deputy commissioner about is who needs that information to improve their program. So for example, things like wait lists, things like how we are communicating with childcare programs about what is and isn't available to them. Do we really need to centralize things like that at the state level, or do we need communication power in localities and regions? So I'm just naming that for you, that some of these data gaps will remain data gaps based on how we collectively prioritize.
It's okay, and it's okay.
And it's okay, exactly.
So you obviously, this came about from a strategic plan of some sort, so look out 10 years. I mean, somebody, child who enters pre-K right now, you're really not gonna realize the benefit from it until they get to be a freshman in high school. So how do we look in the out years
That's a perfect transition. I appreciate you providing that opportunity for me. So right now, we're just trying to land on the baseline data. The next part of this process is to say, when would we expect to see change? Is in each of the areas, right? We'll look at what we would expect to see happen at year 3, year 5, year 10, and really saying our vision is, X by 2030, and how are we making progress towards that goal? We haven't initiated that step yet. Right now it was, what do we need to collect and measure? How do we document baseline? And then how do we set the expectations for when and how much change we'd expect to see?
So what's the expectation of setting such goals?
In terms of the timeline? Great
I
question.
mean, we're putting a lot of money towards this, and if it doesn't have a net benefit.
So when I get into documenting some of the successes we've already seen, again, that's why to me the qualitative data is just as important as some of the quantitative benchmarks, but we are already seeing change in very strategic areas, which is great. But it should be in the next 6 months that we are sitting down and saying, okay, here's what we know about the data we have. In which areas would we set a target for 5 years, for 3 years, for 10? And that is also why it's so important to be monitoring what's happening qualitatively. Because, for example, if we are trying to make change in readiness for kindergarten, and we've seen stable rates in that indicator for the last 10 years, how much change would we expect to see? And are we prioritizing making changes for some of our subpopulations who are really struggling in those areas? Are we really trying to create collective change? So that's the work that has to happen in the next 6 months.
Senator Gould.
I'm sure you know this, but I'll underscore it anyway. Really important not to change the tool that you're using to measure success or what you're actually measuring. We, in the Ed Committee, we get sometimes frustrated in that our standardized tests will change every 5 to 10 years. So it's really hard to measure progress when the target is moving constantly. So
I really appreciate that comment, especially because one of the things that we are writing in the report right now is the limitation on 3rd grade math and reading. So that is actually a major limitation as we look at change over time in test scores and which groups are doing really well and who's struggling. And as you look at the last 4 years of data, in specifically 3rd grade math and reading, we had COVID years. We had years where the test changed. We had biased data collection for a range of reasons. So it is really hard. And I think that that's something, especially the education committees are really going to need to pay attention to in the outcomes for this, not just this legislation, across the board. But that's the one that we're really closely paying attention to right now because the test has changed. Yeah, great point. Okay, let's transition into successes of what has happened in the last 6 months. So one of the very first things I want to honor is that partners across the state have noted an immediate shift from the administration, really going from vetoing a really critical piece of legislation to immediate shift to strategic planning, timely communication, that they feel like they are seeing a different level of attention to implementation, to timely responses, stronger communication, and we're seeing that, right? We are seeing the table on the wall, the new Act 76 webpage established by CDD, a series of consistent communication and webinars to the field about changes and things that are coming. One of the most important things we heard that's a huge, huge win is the simplified applications for funding. So folks from the field had consistently told the Child Development Division, it is so hard. We don't have the time, the capacity, the business savvy to apply for funding when we are trying to work with kids. They heard that feedback, and what we heard this round is this was the most simple application we could have submitted to access funding. So huge.
So we
That's
heard
great.
this loud and clear when we were developing the bill, so it's just good to
Huge
know.
win.
Yeah.
And huge kudos to the Child Development Division's team for actually being able to create change really quickly in that area on expedited timelines. Qualitative impacts on childcare programs. Bless you. So a lot of what we're hearing so far is associated with the readiness grants, the readiness payment program. And what we heard from childcare providers across the state is that we're seeing new programs prepare for licensure. Programs are actively looking to hire new staff and open new classrooms and programs. They're really excited to do that. I really appreciated Senator Hardy's example that she provided where folks are feeling valued in a different way. They can see a path forward. They can see a future in this career, which is so incredible. We are hearing that programs are expanding capacity. They are upgrading their facilities. They're increasing compensation and support for their staff, which might look like wages, appreciation bonuses, supplemental payments. And again, this is largely related to that readiness payment program. Staff are reporting that they're increasing PTO days off for childcare staff. And one of the other really discrete areas that we were excited to see and hear is that programs are spending funds on activities for children, like specialized equipment for children with disabilities and special healthcare needs, that they are able to adapt and offer training opportunities and staff well-being programs for their teams. So really incredible qualitative feedback from the field across the state on what is happening already that you will not see in any number that we can provide you. Yes.
Oh, go ahead.
I'm standing just because my back hurts, so, that mention of the qualitative data and the difference between, sort of outcome where you can see, oh, number of programs increased, versus we had a more healthy and optimistic workforce kind of difference in those easy to measure, hard to measure kind of things. So I'm assuming there'll be some kind of surveys or something to kind of capture that more qualitative data of how did this impact my family's well-being? Like mom didn't have to drive 55 miles 2 times a day to take her kid to childcare or whatever. Is that kind of thing in the works as well?
Yes, so that is exactly the work that we're going to be tackling with Child Trends in the Child Development Division.
Okay.
So we're currently designing what that will look like and how to do it annually and at discrete points in time, possibly 2 points in the year based on some of the things that are happening. But we're also really trying to prioritize not overburdening providers and folks with survey fatigue. So I think that we just want to name that as well, that we are very mindful that folks are maxed out, they are burnt out, and we don't want to overburden, and we want to be able to share their story in meaningful ways.
So some of it is iterative and letting things sort of settle, and then now it's time. So it's going to be a complicated process. You can see that. Yeah.
And I think that's one of the biggest takeaways that I would say from where we are right now is that systems change is hard. It is not fast. And at the 6-month mark, the amount that's been accomplished is tremendous. So we are in really great shape and we still have a lot of work left to do. I want to transition into some of the challenges and unintended consequences. We have a couple more minutes.
Oh, yeah.
And some of this you already heard from the Deputy Commissioner, so I'm just reiterating again what we have heard collectively about where there have been some challenges. So there has been confusion about eligibility for different parts of programs, right? Do I qualify? When am I seeing a change? What does this look like? And the Child Development Division has been really strong in partnering with Let's Grow Kids and others to host webinars to clearly articulate what is happening when and who is eligible, and then following up with frequently asked questions documents. The rate caps, the tuition rate increase caps are an area that we are continuously hearing concerned, specifically related to the true cost of care. So the Deputy Commissioner talks a little bit about this. There's some confusion about when things are effective, and programs and directors are struggling from a budgeting perspective to figure out
that a lot.
Exactly. And I think it's partially because there are two kind of pieces of the law that are conflicting or are struggling, right? So it's at odds with readiness payments where we're saying, please prioritize your staff and pay them well and do everything you can, and we're going to cap your ability to do that. So I'm just naming that is a major point of tension that folks should be paying attention to.
And so one of the questions, I think I communicated with Janet, with the Deputy Commissioner, maybe through Ledge Council, about the rate cap issue and whether or not the department would be making a recommendation on how to better implement that or make change. So something to think about, understanding that that's not what the topic is today, but it is a challenge, and we do hear about it.
The next is really around pre-kindergarten education. So Senator Gulick and the ed committees, I'm sure, are already hearing this as well. But some of our school boards across the state are really struggling with their budget projections. And so one of the things that we have heard is they're trying to design their budgets. They're trying to understand how to project over the next 5 to 10 years, being mindful of pupil weights and any of the potential changes that we're making on pre-K. So again, this is not new. I'm just naming that is something that folks are struggling with. And what I mentioned in House Human Services is we need to figure out what our collective talking points are on what is happening and when related to pre-K, so that folks are all on the same page with what the law is requiring right now, what the projections are.
Yeah, I just wanted to add, they're all, because I'm on a school board, and they're also struggling with knowing whether rooms are gonna be closed down because of PCV testing and neglected buildings that are falling apart and safety concerns, et cetera, et cetera, et cetera. So it's a big problem and we need to deal with it.
Yes.
Just, UPK, what's that?
Sorry, that is my
Oh, it's
fault.
okay, I was an
for acronyms.
acronym guy. I don't-
No, that is my fault. So, universal pre-kindergarten education.
So what I hear from, my constituents is that they don't mind spending the money. The state is, a lot of people got out of the childcare business because they kept increasing the requirements. And they won't have a problem meeting those requirements as long as they see a picture. So I think the vision that was, what are we looking for in the out years is so important when you first, the bill is the bill, it's out, it's an act. And we need to make it work now. And they're gonna say, well, if it doesn't work, then you guys,
Yeah.
the legislature is gonna take the hit for it. That's what we get paid the big bucks for, right?
It's great feedback. It's great to hear from your constituents about this. And that's why I want people to hear us continuously say, it's our collective responsibility to now implement and do this well and make changes when it's not. And that we're all agreeing to that continuous quality improvement, because there are gonna be things that we knock out of the park. And there are gonna be things that we get stuck on and that we need to make different changes. So the more that we can all be in lockstep around, here is the vision, here's how it's moving, here's where we are right now, here's what to expect, here's what's not changing in this moment, but you can expect to see in legislative session 2025, I think it's some of that. It's the collective communication about different pieces.
So we have a guarantee you guys aren't gonna go away in 10 years?
Not planning on going away. One of the other areas is pre-K data, universal pre-kindergarten education data. So this is not something that is new, but we heard a little bit of the challenge coming through the pre-K implementation committee around the final recommendations or the report that just came through. One of the things I want to mention to that is the original RAND study did incorporate, when we designed that study, it incorporated the pre-K component of this, and given the timelines and the funding associated, it wasn't included, which meant that we were going to come into this session without that data and that information. So I'm just naming that we knew some of that already, and the good news is that there was collective agreement in the pre-kindergarten education implementation committee that that the cost to educate a pre-K student is no less than 1. So I think even though you might not have seen a formal recommendation that says, here is how you should move on that is coming to the legislative body where you are seeing collective agreement on that piece. You are also hearing most partners in that pre-K committee say, we're not comfortable telling you what it is because we don't know, right? We don't know what the true cost of educating a pre-K student is, and we want someone to study it. I have heard from several chairs of multiple committees that we don't have time.
We're gonna keep studying.
that we don't have time. So one of the things that we are starting to talk about is, in the absence of that, what decisions can we make? And what other type of, data could be collected in the absence to help the legislature be able to move? So I have talked with Chair Kornheiser and others about this one, because it is a tough one where we don't actually have the information we need to be able to, make a definitive decision. We just don't have that data. So the question is, how quickly can we do something? How comfortable are folks making a decision about it without having that data? But again, the consensus on that committee was, it is no less than 1 for a pre-K student.
Thank you, that reaffirms some of the discussion that we had earlier. So we're gonna be thanking our education folks for picking that one up and carrying the ball, and we won't let it go either.
This is one to stay on top of, because it is having significant impacts across the
I
board.
want to make sure, I want to make one final comment before when you finish, so why don't you go ahead and Senator Kulik.
Well, this may be a conversation for another day, or maybe another committee, but I want to unpack a little bit what data is necessary to make the decision.
Okay, we'll save that one for
Okay,
Ed.
okay.
That's the right question.
That's a good question. What more do you need?
The only other thing I would offer in the areas of concern was the timelines around, there were very expedited timelines across this law. So you are seeing every entity that is responsible for something do the best they can to hit those deadlines, and some of those are not possible. So for example, specifically as we think about pre-K, in the Section 2C report, there was a request for a very robust amount of data on universal pre-K, largely data that we don't have right now. So what you will see in that report, similar to the one that you just saw people waiting, is here's what we have and what we know, and here are all the limitations to the things that we don't know. So again, the ed committees, I'm happy to come back and talk offline about how to support that work as we move.
Well, actually, it might be good to talk online with the ed committee.
Across the board,
Yeah.
having conversations about how we get the right data and how we can prioritize getting that data out is really critical. So just so that everybody is on the same page about what to expect, we again are going to be making everything available on Vermont Kids data. We will also very concretely point you to the Child Development Division's portal, where they have the report, because from a timeline standpoint, that is where you will look for, did we hit the mark at the right time, and where are we now? We will submit the full report to the committee on January 15th. We have the State of Vermont's Children briefing, so the question about this broader baseline and what we know, that annual briefing is January 18th at noon. And I'm happy to come in and talk about, again, where we are or where there are challenges or how we can support different components of data and monitoring efforts.
Thank you. This has been great. The best part about this is how much good work is going on. And we really appreciate the work that both of you are doing. And I'm going to give a shout out first to Deputy Commissioner McLaughlin. I can't imagine the level of work that you've done. I'm glad. I feel that we've taken some responsibility in helping provide you with staff. But as you said, staff's just coming online. So you've done an amazing amount of work in a short time with the limited resources.
Yeah, it's the CDP and DCFG, absolutely.
Yeah, it's really amazing. And the work that you're doing is unbelievable. Just being boots on the ground, community engagement with all of the providers is just wonderful to hear. And it really, for folks who are in the business of childcare, and the business, the science, and the social support of childcare and educational support of childcare, this is huge. And thank you.
Thank you.
Thank you.
Great.
Thank you so much.
Really great.
Yay.
Oh, we are energized
Sounds good.
and enlightened.
Perfect
We're
time.
also